I was asked to give my perspective on the transition of veterinary medicine from back in the 1960s to the present day. A lot has transpired as far as diagnostic work goes and the types of treatment that has been advanced. After being in practice for 49 years, what we did back then probably would not be advisable for ones interested in pursuing the profession at this time. In the early days, why, one person could pretty well handle the calls, and if they had assistance from home with somebody taking the telephone calls and transferring the information over the two-way radio, which I had in my practice car. So an individual could run a practice without too much help at that time. But as the years gone by, the way that practice is pursued nowadays is you almost need more help. And I'm sure with the veterinary hospitals and the advanced technology, that a solo practitioner probably isn't the best way to go. You need more assistance, more office help, and to accommodate a larger volume, especially in the small animal field. So I would not probably be a good representative at this time to advocate anybody going it alone. And if I had my choice, I wouldn't change the way I practiced over the years. But coming near the end of my time in practice, why I didn't feel it was advisably for to invest in taking any on more responsibilities as far as technical work and further diagnostic equipment.
Dr. Dahl, would you please tell us about what a typical day is for you?
Well, at the present time, I'm have limited office hours, 4 days a week. I schedule surgery by appointment away from the office hours, and at the present time, even though the economic conditions aren't real well, I do not think our area is suffering as far as giving attention to the small animals. The volume, as far as I'm concerned, has not decreased, and that the days are still just about scheduled as full as they have been for many years. And in fact, I even have seen an uptick in the number of clients, the number of surgeries in the past 2 to 3 years.
Do you really enjoy surgery?
The surgery I do is more or less routine. Any that requires more technology, I refer to the other practices in the area that have advanced equipment to handle more difficult cases.
What is it about surgery that you find interesting and fascinating at this point? You've been doing it for how long did you say? 49 years?
I'll be going on 49 years.
What is it about the surgery that you find interesting and challenging?
The most challenging thing in surgery, I feel, is that the prognosis for a result that is beneficial to both the client and the animal. If surgery is not indicated, I think it should be explained to the client that it would be not in the best interest of them or the animal. But if there is any chance for survival, why, they should attempt to have this done. And I'm sure the cost is a factor in a lot of situations, but if it's at all feasible, I think it should be attempted if the outcome looks like it would be possible for a good result.
Do you have your own pets?
Yeah, we have 2 cats and 1 Springer Spaniel dog.
Okay. What are their names?
The dog's name is Posey, and the black cat is Buddy, and the black and white female, her name is, I call her Rub Dub. The Springer Spaniel came down with a pancreatic problem 3 years ago, and I have to give a lot of credit to Dr. Slonovic and Dr. Nostel for helping me reverse her problem and continue to live a healthy life.
Is there a strong connection between the veterinarians in the county?
The connection between the veterinarians in this county probably could be a little bit closer knit. We used to have an association where we met once a month, but that has been discontinued, and I think this has led somewhat to a disconnect. And personally, I feel that there should be a little more contact and involvement between the practices, but I don't think it's at a critical point. I think everybody's making good judgments, and I don't think it's a problem now, but I do feel that a meeting among the veterinarians from time to time would be beneficial.
Okay. Is there anything, what about your clientele? Have they changed in their knowledge? Do they surprise you? Is it different how they approach things now than they used to with their animals?
Well, you have 2 different types of clients. There's one kind that are very well versed because you have the internet now, and they can investigate the different problems that have been diagnosed, or look up symptoms and get an idea of what's going on, which makes a public that's more educated now, and they're giving more attention to their animals. But then you still have the certain number that don't watch your animals closely. They see a problem, but they kind of wait to see what happens, and sometimes if they let it go a couple days, the chance of having a successful treatment, of course, diminishes.